Hey everybody, how you doing? I think you have the opportunity to unmute. If you don't, let me know.
Hi, good morning. How are you?
Good morning. Ready? Anybody have a good fourth? Safe fourth?
Yeah, that was good.
Do most of you know who I am? I'm not sure if you've been attending. I know that I think there are two different classes. I've been teaching the lecture for the last 4 weeks with a group from Chicago. So I don't know if any of you are from that group or you've taken another class, another course with another lecturer. Is that the case? Are you guys from what
Chicago. I'm
oh,
from Chicago.
you guys were also with me or
Yes.
okay,
Yes.
great. Okay. All right, terrific. All right, so then yeah, you know who I am and you know the methods to my madness in terms of my teaching style. So yeah, this is a review, but more so I want you guys to be very active, part of this review. So you were given a copy of the 110 questions that I have up. You guys can see my screen, correct?
No, I can't see anything for some reason.
I can just see you.
Okay, now you can see it, right?
Yes.
Okay, yeah.
Great. All right, I'm going to increase the ability to see this. So let me see. I just want to enhance the want to go the other way, not that way. Oh, here we go. Okay.
I don't know
All
why
right.
you're not showing.
Can you see it better?
Yeah.
All right. Terrific. All right, because that'll give us the first 6 questions. So, so that this isn't about memory. You guys have the textbook, correct?
Yes.
And is it digital? You have the digital version or you have the hard copy?
I have a hard copy.
Okay. So just so you know, with the digital, do I have it open here? I thought I had it open. All right, I just have to. Let me just I thought I had it open already. An easy way, it's a little different when you're talking about the hard copy, then you'd have to, you would have to, look it up in the, the index. But if you have the digital, okay, there's a search bar at the top. All right, and I'll just show you, how this could make your studying so much easier so you have Jay sent you was a retired copy of an exam. Okay, so it's definitely going to give you a good insight in terms of, because I know over the last 4 weeks, questions have come up in terms of, what's going to be on the exam. Are they going to be, things about METs and VO2 and things like that. So this exam should give you a really good indication as to what the written exam will be like, okay? And it's in the same format, okay? Multiple choice, 110 questions, okay? But what I'd like to do is have you guys be an active part rather than just listening to me. We're gonna try to knock off as many questions. There will be a break in, during the 2 hours. We'll try to go till 11:30, and then we'll take a break, and then we'll come back and finish up. But there will be the reason why we did this one was because there was another group that will be testing sooner. So we're going to have as a group an additional 1 or 2 review sessions after we finish the 5th lecture. Okay, so this won't be the only, and it'll be on Tuesday night, just like the first 5 lectures were, and we'll do, a 2-hour block of time, okay? So whatever we don't get through today, I will then continue, there may be more of us. I'll probably have to start again from the beginning, but, we should have enough time to get through over 2 sessions after this one, all 110 questions. But even if, as far as we get today, then I would, like you to continue, the format similar to what we're doing here, to help you prepare for the written. All right. Do you guys have any questions for me at this point?
No, I think we're good.
Okay, great. All right. So the first question says, which movement is performed during a dumbbell lateral raise? So let's first, identify what that is, right? So that's you have weights in your hands and you're going this way. All right. So now the question's asking, what is that movement?
Abduction.
Okay. So tell me, is it AD or AB duction?
AB.
Right, okay, right. So so when you think about the word abduct, what are we referring to? Taking
Movement
something
away.
Away.
Yeah, something
take-
away, right? So that's why it can't be A, right? Because if you just look at the beginning of A, it's A, right? So that's to bring it back. So that would be that part of the movement. When we perform a dumbbell lateral raise, okay, the concentric, right? When we're lifting the weights, that would be a abduction. But then as we lower, that would be a deduction. Okay, is everybody clear with that?
Yes.
Okay, let's say you didn't know what those movements were. Okay, so before I now show you how to use the text, give me an example when you're doing B and D, okay, flexion extension. And it doesn't have to be the lateral raise, the shoulder joint, I should say.
Bicep curls.
Yeah, right? Okay, so what am I doing at the elbow right now?
That would be flexion.
Correct, and then this would be extension, all right? But let's say you didn't know any of these movements, right? You could go into the search bar and you could actually type in adduction, let's say, okay? And it will, if you have the digital version, it'll take you to where it is in the text, okay? So you see right here, it's highlighted that, okay? And it'll give me further, information about adduction. Okay, and I think this is helpful because rather than just memorizing it, it's gonna, you'll learn it. Okay, and then as you've been hearing me say for the last 4 weeks, make it real, make it part of your life. And so whenever you're exercising, you're at the gym, let's say not only your own workout, but look at other people and see if you could figure out, what the joint movement is based on the exercise they're doing. Okay, I think that would help. Okay, so is everybody clear on number one? You're good?
Yes.
Yes.
Okay, so number two, a client has achieved an initial goal of being able to run, you know what? I just want to make sure because I thought the other one that I had. Oh, no, this is it. Okay, for a second I thought I had the wrong test. Okay, so a client has achieved an initial goal of being able to run 3 kilometers, or that would be 6 miles per hour on the treadmill. What is the most effective strategy to meet the client's goal of running 7 miles per hour?
C.
Okay, and why do you think C would be the best? Let's look at all of them. So run 6 miles per hour, right? We want the client to be able to run 7 miles per hour, right? So why wouldn't A work?
Because you're trying to increase speed, not distance.
Right, okay, and there has to be that progressive overload, right, in order to see a change. Okay, so B, increase the number of running sessions per day.
It's
Again,
frequency.
yeah, I mean that's volume, right? We're still, unless they're doing something to make it harder, there's not going to be a change simply by adding more sessions, right? And then C, run with sprint intervals at a ratio of 3 to 1. That would definitely be and that was the answer, right? You had said C, correct? Right.
Yes.
Okay,
Yes.
terrific. And then the last one, increase the number of running sessions per week. So that's like B, right? Okay, so yes, the C would definitely be the correct answer, because now we're talking about changing the intensity. Okay, so that person can slowly work themselves up to 7 miles per hour. Okay, good job,
All right.
guys. Any questions on that? No?
I don't think so.
Okay, great. All right, 3, which of the following conditions should always be treated as an extreme medical emergency?
Okay.
A, heat
Right.
stroke.
Yeah, and what is heat stroke? I mean, by the time a person gets, there are other things that'll occur beforehand, right? But heat stroke is the most serious of all of these, right? So, not that we should disregard any of this, but if someone starts to feel dizzy, that could be, an indication that, they're definitely being affected by the heat. Okay, heat cramps, definitely. What would, if someone is experiencing heat cramps, what would we think is going on with that person, if that's what they're saying their symptoms are at that point? What would you tell them to do at that point?
hydrate.
Yeah, exactly, right? Probably their electrolytes are off. Sometimes, eating, cranberry could also be caused not only dehydration, but also from, an electrolyte imbalance. So maybe potassium, but never suggest that it's going back to, working within the scope of our practice, right? And it's not to diagnose or to treat. So, but, asking someone to eat a banana would be okay, as long as they say there's no reason why they were told not to, but that would be something that you might want to. And then profuse sweating, okay? So that's an interesting one, only because, and you probably know this about yourselves. I know for myself, if I work out and it's hot, I don't even have to, it doesn't even have to be hot, a hot day, but I sweat inefficiently, but I can't do anything about it. I don't, when I work out, the sweat just comes off me. So it's very important that I, and anybody that sweats like that, hydrates, okay? So that they don't get to A, especially if they're working outside, like I don't know how the temperatures are today in Chicago. It's very humid here in New York. So, but okay. 4, what is the periosteum?
I put B.
Okay, all right, so this is a good one to actually look up in the book, but let me just see. You said B, which is correct, all right, but here's another great, right, so if I just put in here, okay, it's gonna take me in the book right here, okay, and basically, it's so funny because I think it's on the same page as these, so there's also an image somewhere. Okay, I know it's in the PowerPoint slide, we had talked about, the periosteum, and it gave, so I'm not sure if it's this chapter, but if you get to, unless it's before that, let's see. Oh wait, yeah, it should be, here we go. All right, so here's where they're showing the periosteum here. I'm surprised it didn't take me to that page, but it will give you a better description of what the periosteum is, okay? So that's why I'm encouraging you to, to use your textbook, okay?
Mm-hmm.
All right, but you also had this image in your, the PowerPoint slides. All right, any questions?
No.
Okay. All right, 5. What is the purpose of the HIPAA? That's the Health Insurance Portability and Accountability.
E.
Yes. Okay, so yeah, when you're collecting data from the, all of the health forms that you have to fill out, even if it's Part Q to, the full med history form or anything that they may share with you, it's your responsibility to protect that person. Okay, so that's what the HIPAA Act is all about, is that you can't have those files out for all to see, that, you will be held accountable if that were to happen. Okay, so everything has to be private. All right. Stop me if you have any questions, if you're not 100% certain, but yes, the answer was B, to protect each individual's private health information. Okay. Okay, 6. A new client plays football. He is 6 feet tall and weighs 250 pounds. He is interested in increasing his lean to fat mass ratio. Which of the following method for assessing body composition provides the most relevant data?
Your skin fold measurement.
Yeah, so
D.
let's talk about why the others may not be. What do we know about, body mass index?
It doesn't differentiate between lean muscle and fat.
Correct, right? Girth and, waist to hip, these are other methods, but, what the question's asking here is, out of all of these, even though we didn't spend time, in the lab actually doing skin fold, we talked about during lecture that there was the gold standard, which was what? For assessing body fat?
The water one?
So this hydrostatic weight, but DEXA, the scan.
Oh.
Okay, that's the the most accurate. Then you have the hydrostatic weighing. Okay, but I told you, I explained that. Remember, I told you my experience within the tank. So whether the person can continue it is one thing. then there's other things that you have to account. Remember, I told you have to do the vital capacity so that they can account for any residual air in the lungs. Did they get all of the bubbles out of their bathing suit, their hair, things like that? I mean, the DEXA, the person just lays there. So it's very, the margin of error is much smaller because there's not a lot that can go wrong during the test. But, if we take into account from a financial perspective, right, the skin fold is a lot cheaper to do compared to, having a place to put a tank, so people can be measured through hydrostatic weighing, and then the DEXA scans are expensive. But, what do you remember what I said about skin fold in terms of its effectiveness?
Need a lot of practice.
Practice a lot.
Exactly, right? Because there's a lot that can go wrong on not so much on the. Oh, and then I have to say, I have done body fat on obese individuals, and sometimes because of the amount of fat, especially if I'm choosing the sites that are just around the hip area or the belly button area, you can't even pinch sometimes because the skin is so stretched, and there's just so much fat that you can't grab anything. And remember, when if you do decide you want to get into skin fold, I totally recommend it. Actually learning it, you have to pinch just the skin and the subcutaneous fat. You don't want to grab muscle. When you put the calipers on, you want to go halfway in on the fold, not all the way in on the fold. You don't want to release the caliper too long because then it compresses the tissues. Okay, so there's more to go wrong on the person who is administering the test than there is with the person that you're performing the test on. Okay.
Why would we perform the test?
Skin fold?
Like, I know that it's to figure out like their body mass, their fat percentage, but like, what is the necessary point in that? So
that we talked about risk factors and how 30. I'm just going to use the number 30, but it varies slightly, men to women. But if someone's in excess of 30% of fat, they're considered obese, and obesity is a major risk factor. So we're trying to do a full assessment on that individual so that, determine, how strong they are, what's their cardiorespiratory system like in terms of, their being apparently healthy, right? The guidelines that ACSM has put out. So we know that heart disease or disease in general is linked to obesity. So we're trying to do a full assessment on that individual so that we can then, guide them in the right direction in terms of, getting to a healthier lifestyle. Does that answer your question?
I mean, yeah, but I'm thinking in like a real life situation. If I were to get a client, you'd probably usually be able to tell if they're obese. And that they would want, their goal would be to lose weight. I just don't know if like literally getting their body fat percentage is like a necessary thing to do.
I hear you. I mean, and as a personal trainer, you have, the right to offer these things or not. I used to offer it as part of the assessment, and I had people that told me that they didn't want to have it done. I always gave it as I said, I'm not going to make somebody do an assessment that they don't want, but it just gives you more information. And then, we had talked about 12 weeks after you work with somebody, you're going to read. Somebody just shut down their mic because there's a lot of background noise. Thank you. That 12 weeks from now, when we retest and hopefully all those numbers are going to be have improved, right? That's a motivator. All right. So, but if you don't feel comfortable, and certainly if the person doesn't want to take the test, you're not obligated. All right. But it just kind of identifies, whether that person has a risk for heart disease based on, their percentage of body fat, and it can be used as a motivating factor, so that when you retest, they're going to start to see. But, taking measurements with a tape measure, that would work too. So, but if that's not something you're comfortable with, then you don't have to do it. Okay, that's completely up to you.
Okay,
All
cool.
right.
Well, yeah, that answers my question.
Okay, great. Thank you. Okay, so 7. Which muscle is the agonist when performing elbow flexion? So let's talk about what an agonist is first. Remember we,
Oh, it's kind of like the opposite muscle. I don't
The
know, for
muscle,
lack of a better
the
term.
muscle doing the
Muscle that
work.
doing the other. If
Okay.
one is concentric, the other is eccentric.
right,
So
so agonist, antagonist, those are the words, right? So agonist is, someone said it, the one that's doing the work,
one of them.
and then what you were referring to is the antagonist. Okay, so it's the opposing muscle. All right. So in elbow flexion, what muscle's doing the work?
Biceps.
The bicep,
Right. So that would be then that muscle would be what?
the agonist. I mean, yeah, the agonist. Yes.
So what's the opposing muscle then?
The
Tricep.
triceps.
Tricep, right? So that would be the antagonist. Okay. That makes sense, guys? Let me know now, because if it's not, I'll try to explain it more.
Yeah, it does.
Good? Okay, great. Okay, so we're doing a leg curl. What muscle is, first of all, what's the movement at the knee?
Flexion,
The
Right.
flexion.
And what muscle?
hamstring,
Hamstring.
Right, and that would be agonist or antagonist?
agonist,
Okay, and what's the antagonist?
Quads.
quads,
You got that? That's it. Okay, 9. A personal trainer is working with a new client and needs to perform the following tasks. Okay, so they need to do a cardiorespiratory fitness test, muscular strength and endurance, obtain a written or verbal informed consent, conduct a health history with risk factor stratification. So which activity should the personal trainer perform last?
Did we skip question 8?
Oh, sorry, did I do that? Okay, I'll circle back. Sorry about that. Thank you for letting me know. So tell me, question 9, what's the answer? And then I'll circle back to 8.
administer tests for muscle strength and endurance last.
Okay, right. So, so the question is, which should they perform last? Right. So we're doing it would be B, muscular strength and endurance, right? And remember, we're going to do all our forms first, right? We're not touching this person until we know, that everything is good to go. And let's say something comes up on the health history, and it falls within the guidelines. What's the next step that we would have to do before we could even get to A and B?
Get
So if
medical
we have all
clearance.
the forms filled out, something is sending a red flag. What's the next step?
They need to get medical clearance.
Correct. Okay. ACSM, I showed you that book, the Guidelines for Exercise Prescription Details. Remember, they update that every 5 years. So, nothing major, but it's all based on research. But in their book, now, when I was doing the certification years ago, there were many more, if the person had 2 risk factors, they need to get a medical clearance. Now they've gone on, based on research, to organize the guidelines a little bit more, simplify them, so you don't have, people don't have to rush off to the doctor. But again, I told you, don't feel comfortable. All right, you're always better to err on the side of caution and get clearance if you don't feel comfortable working. If the person's pregnant, and yet you don't have any experience with working with pregnancy, or has MS, or Parkinson's or whatever, you always best to get trained and then work. So you're always better to be prudent and maybe pass that person on to someone that has that experience with that person, or maybe you co-train. But you really want to learn about what's contraindicated and so on, what's safe. You want to be able to have access to the doctor based on whoever you're working with. Okay, so that would be another thing you need to consider.
So if medical history is the only risk factor that they have, should they get medical clearance? Say everything else comes out perfect.
Yeah, so if you look at the ACSM guidelines, I'm pretty certain that that one you don't. And remember the other, what was one that you can't change that I told you that now, I have?
Well, age.
Yeah, right. So if everything else checks out and the risk factor I have is age, right? And then also my dad, died sudden cardiac death, but he was 81 when he passed, right? It's more of a concern if the person lost a sibling or a parent under the age of, I think it's 60 for women and 55 for men, something like that. And I also mentioned that, if my father ate McDonald's every day, didn't exercise, smoke, and drink, and we could say, well, that's probably what led to his death, right? But there's no way to know for sure. They just know that based on the research they've done for years on large numbers of people, that it tends to be more of a risk than not. So yes, it depends on the risk factor that person has. Okay, but if they're hypertensive and they have high cholesterol and things like that, they smoke, those are going to be the ones that you're going to want to get clearance. Okay, a good question. All right, let me circle back to 8. So the client shares personal information with the personal trainer. For which issue should the personal trainer refer the client to another professional?
C. Maternal.
Okay, right. The client purges after eating a big meal. What was that? What was purged?
Bulimia.
Yeah.
Yeah.
Right. So they eat a lot and then they throw up. Okay, and sometimes even if they're not forthcoming on that, what's some of the signs that you might notice?
Oh, I forgot.
Teeth.
Some
Say
people
again?
have teeth,
Problems with
like
their
issues
Yeah,
with your
right.
teeth.
Yeah, because of that acid coming up. Okay, it affects the teeth. That they might have bad breath. I mean, over time, if they start to tell you, that they're not feeling frequently, they're not feeling well because they feel like they have indigestion, right? That's going to burn the esophagus, all right, the acid from the stomach. So you might start to get signs and symptoms, different from anorexia, right? It may not be so obvious, because they're not, extremely thin, but this is what they do. They enjoy that food, but then they feel guilty afterwards, and they throw up. Okay, but yeah, you might see some of those things. It takes time for for those things. Like bad breath is probably one of the first ones, but if you start talking about the breakdown of the teeth and things like that, the esophagus, that might take some time. Okay, but don't be surprised. I think I shared a story with you guys. You could be working with somebody and at the onset, everything is fine. Okay. That they've been honest with you. The med history forms, check out. And then just working with you, over time, they become addicted to exercise, right? Because they start to see the changes, and you're going to see, I think I shared with you, I had a woman that was, at that time, she was probably in her 20s, I would say. And, college age students, I think someone, I don't know if that person's here in this group, but did share during our lecture that I think it was a college, or a couple of you said something about college roommates, right? So, it's very prevalent in, I think, teenagers and especially college. And, that it's something that you may not have to deal with at the beginning, but you're going to see that the person is starting to change. And then the best way I can describe it is that they become addicted to it to a point where, the benefits of exercise now have become a risk because of how they are. Okay. So, definitely keep your eyes open for that, because it does happen. I tell you about the woman that I was working with that, and she was a mom. I mean, this was a woman that was in her 40s. This was back in the day, it was the Atkins diet. Now it's called the keto diet. But she was always on the latest diet. And I was always saying, Jerry, stop, right? Get to her house one day. She literally could barely open the door and stand to let me in, because I was like, what the heck happened? And she's like, oh, I'm in ketosis, and I'm like, I had to pick her hand up. I mean, she couldn't function. And I'm like, Jerry, we can't train today. So, and this was a grown woman with 3 kids. Okay. So you are going to run into this, these issues. Okay, all right, up to 10, I think, right? When going from rest to steady state exercise, what is the volume of oxygen, the volume of oxygen that is missing in the first few minutes of work? Before we answer this, what is steady state?
Like a steady state heart rate, you're keeping the same rate.
Correct, right? We figure out that zone of 60 to 80%, okay, or whatever the percentage is, and that person is maintaining that, okay? But we talked about, and there was a graph, right, that I showed you, and there was the way oxygen, what happens to the oxygen, and so there's a section before things steady, okay? That's what we're talking about. So what is that?
Oxygen
Oxygen
deficit.
deficit.
Right. Okay, so B, right? And then we pay it back on the other end. Does that get better as the person becomes more fit?
No.
Actually, it does. It
Yes.
never goes away 100%. We've all known this, all right? Right? When we start exercising at first, our heart rate is increasing, blood pressure is increasing, the demand for oxygen increases, but you'll see that over time, okay, unless you're going out for a sprint, okay, but even that improves, that deficit improves. Okay, so there's a shorter period of time as that person becomes more cardiorespiratory fit, okay, increases fitness level, where that deficit will narrow, okay? All right, and then, so what's out of these four, then what's the name of when we're paying it back on the other end?
EPOC.
I'm guessing debt.
Okay, that's C, right? EPOC.
I mean,
Excessive, yeah, that's what EPOC stands for, okay?
It's all right.
All right, good job. All right, 11, personal trainer listens attentively to a client's complaints about their progress. Which characteristic is personal trainer exhibiting? Now, guys, listen, we still have one more lecture. This will be in the lecture next Tuesday. So, but it'll be good, because now when we get to this in the lecture, you'll know a little bit about it. Anybody want to take a crack on what that is?
How about C?
Sympathy?
How about C?
What I didn't, was it C or D? I didn't hear.
C.
Let's see.
Okay, so actually it is D. Okay, respect. And again, we just got into this. I mean, we haven't gotten into it, sorry. So this will make more sense, because I have, if you look at the 5th PowerPoint, it has all of these things identified. Okay. All right, 12. A client has cardiovascular fitness goals as opposed to health or performance goals. Which program is most appropriate?
I wasn't sure, but I put B.
Okay. So what made
Yes.
you, the answer happens to be correct, B, okay? What was it that made you doubt yourself?
Well, I would say that C sounds like it would be pretty intense too.
Okay, like
And
6
they,
minutes?
they're looking for fitness, so it needs to be more intense than health.
Okay. All right, and you recall, we talked about health-related goals and performance-related goals. What were the performance ones?
Those were like 7 days a week, like high intensity, hard as you can go.
Okay, right, yeah, there was a chart that we looked at, but like if somebody tells you that they're training for performance related, what are some of the things that they're looking to improve?
Speed, agility.
Correct, right? Okay, as opposed to the list of health ones, right? Did we say though, are the performance ones just for athletes?
No, not necessarily.
Correct. And the example I gave you guys was, let's say a 60-year-old woman is, 70-year-old woman is walking, has the right of way to go across the street, the lights in her favor, but someone comes barreling around, the corner, and the person now has to have that speed and agility to be able to push them back up onto the sidewalk. Okay, so yes, they're definitely, all of these things are important. Okay, but yes, the answer was for 12 was B. Okay. Okay, 13. What is the most important variable to determine cardiorespiratory fitness gains?
C.
Well, A.
I put C.
Okay, so what did we say? B? Did I hear B?
D.
Okay,
C.
B, and there was another one that somebody
I
said.
thought it was
A.
I
A.
put
Oxygen
C.
consumption.
I put C. Oxygen consumption.
Okay, so what is the most important variable to determine cardio fitness gains? Okay, so let's talk about we took cardiorespiratory fitness, right? So give me another name for that. Let's go with that first. What's another word that you hear instead of the CRF? What is another word that you've heard that is the same as cardiorespiratory fitness? Is it strength training?
Endurance.
No, aerobic.
Aerobic, that's the word I was looking for, right? So we're talking about aerobic, okay? So that right away rules out B, right? Body fat percent, okay? What did we say about oxygen consumption? How are you gonna be able to determine that?
Need special machines to do that.
Yeah, right. So you could do submax or maximal the GXT, graded exercise. Okay. If you're in a fancy lab, yeah, they would measure the gases and so on. But there's formulas if you're just putting someone on a treadmill or a bike and you're doing heart rate, blood pressure, and all. But so you do have to collect data, and then by equations, you're able to figure out the person's oxygen consumption. All right. What did we say rating of perceived exertion was?
Like how hard they feel they're working on a
Correct,
scale.
right? Yeah, there's a scale 1 to 10, 6 to 20, and next to the numbers, there's going to be, extremely light, moderate, and so on, up to, to extremely intense, right? So that's just a perception of how they feel they're working. So if we're looking, probably one of the most important benefits of aerobic or cardiorespiratory fitness is resting heart rate, right? Because why do we think that's important? Why? So we know that if someone's been training for a period of time, all of their heart rates are going to respond lower over time. Why is that important?
Because it's more efficient.
Yeah, but explain what that is. Like what's more
Their
efficient?
Because their heart,
Your card-
they don't have to, their heart is not working as hard.
That's it.
cardiac output.
Right. So
Yeah.
if you start off with somebody and you measure their resting heart rate and it's at 80, let's say, okay, and then you have somebody else, okay, or take that same person and 12 weeks, now their resting went down to, let's say, 70, okay, their heart is doing exactly the same amount or getting the same amount of blood out, but with less beats. So the heart is working less, okay? So 12 weeks earlier, that heart had to beat 80 times to get the blood out, where now the system's become more efficient, so now it only has to beat 70 times to get the same amount of blood. Okay, so it's less wear and tear on the cardiovascular system.
Makes
As
sense.
well as respiratory, right? Because that's where we're picking up the oxygen when it's in the heart, okay? That clear?
Yeah.
So is the answer A then?
A, right, resting heart rate. That's going to be our determinant without any fancy equipment, okay? Is that if we take somebody's resting heart rate, when we first start with that person, and then when we retest, we take their resting heart rate again and we see that it's lower, we know that that's a really good indication that their cardiorespiratory system is operating more efficiently.
Can I ask a question?
Sure.
So when we're taking the test, are we looking at the questions as like directed towards us in the field, like if we're working with a client versus what the clinical setting would be? Because like the VO2 max and all that, we wouldn't figure that out. But so is that kind of how we can look at the test questions?
Yes, I mean, there may be questions, and we'll see as we move on here, that are specific to scope of practice. Like, they might say, which of the following is within a personal trainer's scope of practice, and there may only be one where the other three would require, a physician or something like that. But yes, that's a good way to look at it, is from the personal training side, right? Because that's there's certain things that are within our scope of practice, and then other things where we have to bring in professionals. Okay. Does that
Okay.
answer your question?
Yeah, yeah.
Okay, great, great. How do you feel? How do you guys feel with it so far? Do you feel less anxious about the test?
Yeah.
Hopefully.
I feel
It's
it's
going
better
through-
than the one from the 7th edition.
Wait, say that again.
I said I feel this one is much easier and better than the one from the 7th edition.
Oh, okay.
That
But is it maybe because of the way? Are you finding the way we're going through these questions to be helpful?
Yes.
Yes.
Yeah.
Yeah, because and the reason why I wanted to talk about, so basically when you talk about multiple choice questions, there's one correct and then the others are called distractors, right? So in this case, there are 4 choices. There's going to be one correct answer and the other 3 they call distractors, right? They're trying to distract you from getting to the correct answer. However, in the review we're doing now, there may be questions where one of these distractors is the answer. So that's why I'm trying to not only focus on the correct answer, but also let's look at the others to determine why those aren't correct, what they are, so that they may show up as another question at some point and you're going to know the answer, okay? Because you know what that is, all right?
Do we have access to this test?
Yeah, you were sent, Jay sent it to you.
Oh, it was in a previous email? Okay.
Yeah, in preparation for the review. Yeah, he sent out an email and attached the test. Okay. All right, 14. What is the primary reason for obtaining an informed consent?
Ensure the client understands benefits and risks.
Absolutely, right? It states that right in. If you're not sure about this, go back and look at the informed consent. Okay. We want to let them know that there are inherent risks. However, the benefits outweigh the risk, and you're doing everything you can to reduce the risk, right? And part of it are all the forms that you're collecting data from, okay? And then, you're making a judgment call. If there are any red flags, you're going to go get, physician's clearance, and that's going to lower the risk, even more, okay? That you're working within your scope of practice. You're working with people that you feel that you have that expertise, right? If it's out of your scope of practice, like I mentioned earlier, you're not used to working with pregnant women, you're not used to working with people with diabetes, you're not used to working with people that have MS, cancer, anything like that. There are trainings for all of those things, guys, and then I definitely recommend that you seek that after you get certified, because you're going to need, I mentioned this already, you're going to need to take what's called, CECs, continuing education courses, because I don't think you want to retest again. So once you pass the test, you want to keep it by just getting the CECs. And so that's when I take the time to learn something new. Okay. So if you're working with a certain population, or, you wish to work with the population like that, then go ahead and get that additional certification through CECs. Okay. Okay. 15. What correctly matches the bone with its classification?
A.
Right. Okay. So where's the femur?
Upper thigh.
Right. And that is considered a long bone. It's the longest bone in the body. Okay. If you look at that, I still have that image on the right. That actually, yeah, I think that, oh, it is the femur. Yeah. As I said, it looks like the femur. Yeah, so that's the femur right there, longest bone in the body, but it is the upper leg bone, okay? The thigh bone. All right, where's the ulnar?
It's the pinky
It's in the
side of the
forearm.
forearm.
Right, okay, so we have ulnar radius here, and then tibia?
That's in the leg.
Leg.
Yeah, what would be the layman's term? The
Shin.
tibia? The shin,
Shin.
right?
Chin.
Okay, and then the vertebrae?
Back. The spine.
Spinal
Yeah.
column.
Cervical, thoracic, and lumbar. What's coming to mind? Crazy story this week. I think I shared with you guys that I'm a professor, and I'm teaching an async course right now. It's actually women's weight training. And so I wanted the students to, I'm using this digital tool for VoiceThread, where I wanted them to post themselves doing the squat so I could correct them. And a student reached out. I'm not sure how old she is. She's probably, definitely, graduated high school, obviously. So she's in the late teens or early 20s. Back in January, she was driving her car. She got rear-ended and T-boned on the passenger side. It flipped the vehicle over. She's paralyzed from the belly button down.
Oh, no.
I met the most remarkable person that, and I always say this, I always say there's going to be students that are going to teach me more than I can possibly teach them. Her spirit, her enthusiasm, she believes she's going to walk again. She's got some sensation,
Wow.
but the reason why she reached out to me is because she was big into exercise before the accident. She got into powerlifting, so she has video of herself doing the squat. I said, great, post that. But she's very open about her disability now, and I'm sure all the, because what she wants the other students in the class to realize is that if she can still do something, then the other girls have no reason not to do it, right? But yeah, pretty amazing. That when I saw the word vertebrae, I just went back. But yeah, pretty remarkable woman, I'm telling you.
Wow.
Okay, 16. Water constitute what percentage of human body mass?
60%.
60.
Yep. Okay, so yeah, it's the, I mean, you think about that, it's insane, right? 60 to 70% of our body is water. So this is why it's so important that we maintain hydration. Okay. All right, good job, guys. All right, 17. A person with type 1 diabetes is beginning a new exercise program. Which action should this person take prior to an exercise session? Before we answer this, what is type 1 diabetes?
What's
Eating processed carbs.
Okay, yeah, and so the process of it's difficult to process carbs. Why is it difficult? What is that person missing? Or that
insulin?
insulin, right? Sugar levels go up in the blood. Everything. The body's always trying to maintain homeostasis, so insulin's going to be released to balance that out. So type 1, a person is completely insulin dependent because their body does not produce insulin. So with that information, what's the answer to C, to 17?
B,
Could
maybe.
be. Now I'm confused.
Could be B.
Okay, so it's A is increased insulin dosage.
No.
B is assess blood sugar levels. C, inject insulin into the muscle being trained. And D, abstain from eating. Okay, right. So the only one that really makes sense is, we don't want to, hopefully this person is prudent, with their situation, but, they want to test for it. And you would probably want to say that, did you test your blood sugar levels, okay, before the workout? And then they will tell you yes or no. And, but yeah, you don't want to just blindly increase insulin, right? If the blood levels are fine, or inject it into the muscle, and then abstain from eating, that's going to totally throw everything out of whack too. So it's very important for somebody to, eat on a regular basis, especially if they have diabetes. Okay, small meals throughout the day is usually what's recommended. All right, is everybody good with that one?
Yeah.
Okay, great. 18. After several long distance runs, a client is diagnosed with shin splints. What structure has most likely been impacted?
B.
Tibialis.
B.
Anterior.
All right, so where is we mentioned this word before, shin, right? So where's the shin? We said that before. We said the ball.
Front of the lower leg.
Okay, the tibia, right? Didn't we say it before, the tibia?
Yeah.
Yes.
Okay, so then what muscle would it be?
Tibialis anterior.
Tibialis anterior, right? So we know, I don't know if you guys can see me, but the tibialis anterior is this muscle right here, okay? That's the tibialis anterior. Anybody know how you can really truly tell shin splints?
I do not.
So if you have a tuning fork, you hit it and you bring it you don't even have to touch the muscle. The person's gonna, hit the ceiling because it's very painful from the vibration of the tuning fork, okay? I've had people tell me that they have shin splints, but, you got to talk to them. Well, what have you been doing? If they just started a running program, okay, what's the action of the tibialis anterior? What does it do with the foot?
Flexes it.
Yeah.
So
Or
this,
flex-
right? See this get tight every time I do this at my foot. You guys see what I'm doing?
Yeah.
Okay. So if a person is running versus walking, is it fair to say that more of this is happening?
Yeah.
Okay, right?
Yes.
Much quicker,
Yes.
more rapid, and more of that going on. So By the way, is that dorsal or plantar flexion at the ankle?
Dorsey.
Right. And so a lot more dorsiflexion happening during a run than is happening in a walk. A lot more dorsiflexion happening in a power walk than just a casual stroll, right? So if you talk to somebody and they say, yeah, I just started running yesterday, and they're telling you that they have shin splints, there's a good chance the muscle is just sore, just like any other muscle that they really haven't worked on that intensity level. Okay. So but again, scope of practice, you're not going to want to diagnose this person if the person really believes that, then they should go see their doctor. Sometimes an ice massage, I often will tell my clients to keep ice in Dixie cups in the freezer, and they could peel back the cup and do an ice massage. But if the problem is continues to happen, now we're talking about that they definitely should. Yeah, and shoes, sneakers. Okay, people they use their sneakers way longer than they should. Okay, so I've proved this to people. I actually will ask them, well, take this sneaker off, let's look at the bottom of them, or I'll just look at the bottom myself and I'll see where it's worn. And then I bring that to their attention. You see this, this is, so depending on how frequently they exercise cardiovascularly, they're going to want to change their sneakers more regularly, 4 months, 6 months. Okay. Okay. Nice job, guys, on that. All right. So that was 18. Okay. And we know the other structures, right? The Achilles tendon. Where is that?
Calf region.
Okay. Right. So it's actually what anchors the gastroc, okay, to the heel, the calcaneus. So it's this here, okay. And what about the quadricep?
The thigh.
Thigh muscle.
Yep, right. And the iliopsoas.
No idea.
In the pelvic region.
Yes, exactly. Nice job, guys. All right, 19. Which legal term should be used to describe injuries that happen when no one is at fault? All right, I think we're also going to be addressing this on Tuesday. So if you have the answer, great, and then we'll get into it more on Tuesday.
B.
Inherent risk.
Inherent risk. Okay, so which legal term should be used to describe injuries that happen with no one at fault, right? So negligence wouldn't be, right? I told you the story about the woman whose fingers, I mean, she was negligent, really, but they found that the pin didn't have that locking mechanism. So I think she successfully, or they settled with her because of that. So I don't know about Chicago, but in New York, if you join a gym, you sign a waiver. Okay. Do you guys do that in Chicago when you go to gyms?
Yes.
Yeah.
Okay. Again, you have to look at the laws, depending on the state that you practice in, the laws change. But here, if a facility is negligent, you cannot sign away your liability. Okay, so even though you're signing that, if there's cause, then you can hire an attorney to present a case. Okay, so product liability, and then breach of duty. Yeah, so that the one that made the most sense here was B, the inherent risk. Okay. All right, 20. A 37-year-old male is currently inactive and overweight. The client is interested in improving overall health and decreasing risk of disease. Which method of assessing body fat percentage is most effective method given the client's goals?
Put C.
Put A.
It's either A or C.
Yeah,
So
C.
when we're looking at this, I know we already spoke a lot about these various methods. Think about it in terms of not whether you have the equipment or not, but what it would be the gold standard out of these.
Doing A, the girth measurements.
That's the most accurate out of the 4 of them.
No, hydrostatic weighing would
I
be.
put D. I put hydrostatic.
So this question,
But-
it's I think where you guys
Yeah.
were going with this is you were thinking from a practicality, like what would you have access to, but this question is just asking in general. Okay, out of these 4, what would be the most accurate measurement or predictor of percent body fat out of these 4? Okay, and that's who you want to look at.
So it's,
So
the answer is D?
D, correct, hydrostatic weighing. That's the most accurate out of the four. Although you may not have access to, hydrostatic weighing equipment, and you may choose to use, one of the other three, the question's asking which out of these methods, what's going to give you the lowest margin of error, okay? And that's
Well,
going to be,
I thought given his goals, considering he's not an athlete or anything, we wouldn't choose that one because that's supposed to be like somebody who'd be really concerned about their body fat percentage.
I think, when I'm looking at this question, I'm thinking that they're trying to, because it says, if you look at which method of assessing body fat percentage is the most effective,
Right.
so which is going to have yield the lowest margin of error, and out of these four, it would be hydrostatic weighing. All right, so that's, you got to look at some of these key words right here. It's asking here most effective. You see that?
Yeah.
Okay. May not be practical because you may not have access to a hydrostatic weighing.
I guess I just
so-
get thrown off by the given this client's goals.
Yeah.
So maybe that's the trick of it.
That's exactly right. I think in this question, what you need to be focusing on is those two words, most effective. Okay.
Mhm.
By the way, guys, all the tests out there, all the, the certification exams have a written aspect, and most of them went that way. ACSM, when I was certified by ACSM back in the day, they had a practical side. They don't do that anymore. And I would argue to say that since the pandemic, most everyone except for WITS, which is so great that you guys have that practical side, because that's really the true test of knowledge. If you look at the research on what's called summative assessments, which is what a multiple choice test is, based on compared to formative, which is what the practical is, where you can test in real time, you can show your skills, you can get feedback in real time. Those tests are more valuable than this. So although you have to pass a summative assessment in this case to be able to get your certification, it's not a true measurement of knowledge, but you're going to have to just go through it and know, look it up on Google, like what's you'll get a list of things that are used to set up questions. Like I use the term distractor, distractors versus correct answer, right? They're throwing three other choices that are distracting you from the point. And the best thing to do is, if you're questioning something, just go back and really read the question and look at the words that pop out, okay? And then if there are several of them, like the client is interested in improving overall health, or whatever it was about this question that kind of made you focus. They gave you a little case study, right? That's how it started. Then it got to the question, really. The question was, forget about the guy, right? It doesn't have anything to do with this 37-year-old person if you really look at this. Because if you just look at the question itself, which method of assessing body fat percentage is most effective? What is the most effective method? Make that the question, right? What would be the answer? Hydrostatic weighing. But now we got caught up in some of the other stuff in this question, and it threw us.
Right.
Okay. You can be smarter than, and then that's the thing. Multiple choice. They're trying to trick you, right? Which is ridiculous because you really.
Can I ask you what percentage do we need to pass this quiz? I believe it was 70. I just wanted to make sure.
Yeah, that sounds about right. I believe.
Okay.
Yeah.
Thank you.
Okay. All right, let's do a couple more and then we'll take a break. All right, so 21. A client presents a notable posterior pelvic tilt in standing and limited pelvic range of motion. All right, so right again, another case study, right? Let's just look at that first. What's posterior pelvic tilt?
I get confused on these.
Yeah, me
It's
too.
like, okay, so let me
lumbar, like your butt points out further, right? Sticks out
yeah,
further.
I happen to have the bones here, right? Does that look familiar?
Yeah.
Okay. So, all right. So this is the sacrum. So we know this is the back.
Mhm.
Okay. And now we have the pelvis here, right? So a posterior pelvic tilt would be tilting back. Okay. So, right. Posterior, anterior. So the person would be like that. I try to
Okay,
think
so we look at like the wings of the.
that's exactly right.
'Cause
That's how
that's why I get confused because it doesn't look posterior on the. Okay, I got it.
right. No, and I totally get it. So this is that's a good point, right? So this is the anterior side, right? We always know, and this is, I'm glad this question came up because I tell my physical educators that I don't understand how anybody could work in this field and not know anatomical positions, okay? What anatomical position is, what movement is at the joint, what's anterior, what's posterior, all the movements, abduction, adduction, flexion, all of that. There's no way, right? And this is a perfect example. So how I remember it, this will always be anterior and this back here will always be posterior. That's not going to change, all right? So if I'm standing and my hip does this, right? So it does that. It's going back. It's going towards the posterior. This is moving anterior,
Mm.
but the back is moving posterior. So it's a posterior pelvic tilt versus what would somebody look like if they had an anterior pelvic tilt?
You leaning over.
Get more of a lordotic curve, like they'd be like more like this. Okay. So that would be that the pelvis tilted forward. Does that help?
Yeah, yeah.
Okay, great. That's just one of those things that you have to look at bones and just see the movement. But I struggled with that for a while myself until I really had an understanding of, the pelvis is moving back, it's posterior, the pelvis is moving forward, it's anterior. Okay, if we can keep it at that. All right, let's do this. What are we up to? Oh, wait, no, we got to finish the question. Which of the following muscles are likely to be tight and need stretching, right? So the person is tilting back, okay? Out of these muscles, which one would you think, 21, what would be the muscles that would be tight?
Hamstrings?
Hamstrings. Hip
Uh,
flexors.
Yeah, so more so, what's the muscle above that would probably be, I'm not arguing that.
Your glutes.
Right, the glutes, okay, right? Because they're right there at the, right? So it's kind of like, but there's no doubt. The answer happens to be D, but there would be no question, that the hamstrings would be tight as well.
So
So
what is the answer? The answer is D.
D, yeah, D is the best, is the correct answer, but I'm not disagreeing with you that C could also, but again, what out of the two, what would be the better of the two is what you're looking at, okay? But it would be the glutes, okay?
All right.
All right, let's take a break here, and we will. I just want to make sure that. C. Oh, wait a second, guys. I'm sorry. It is C. It's not D. C is the correct answer. Yeah, because I was looking at them like, wait a second, my eyes got shifted on the questions. It's C. So let's go back. This is the definite. It's the hamstrings. Okay.
All right.
Sorry about that, guys. Yeah, the correct answer. So just know 21. The correct answer is C. All right. Okay. Let's take a break here. It's 11:30. Oh, well, you guys are 10:33, right? So let's take. I'd rather you guys tell me. Would you rather have a shorter break so we have the rest of the time to go through as many more questions as we can? Like, does a 5-minute break work, or do you guys want a 10-minute break?
5 is fine.
Five is fine.
Okay,
Right.
great. All right, so let's come back in 5 minutes then. All right, so 10:38, 39, somewhere in there. Okay.
All right.
All right. See you in a little bit. All right, guys, back with me?
Yes.
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 I figured make the most of this since we only had it. You know, if you think about it, I can't believe we're already doing this for over an hour. I feel like we've been working for 10 minutes. All right, we're up to question 22. So what is the primary mechanism of heat loss? Actually, I think we talked about this lecture 4, right? During high intensity exercise or exercise in a hot environment.
Evaporation.
Right.
Evaporation.
Okay. We did address all of the others, but you know, we were talking about sweat earlier, but you know, the best is that you know, the more efficient sweater is somebody who sweats and then it kind of glistens on their skin and then it gets evaporated, right? If somebody sweats that way, they're less prone for what? If they're like the skin glistens and then they're able to, it evaporates. What are they less prone for?
Overheating?
Say again? As opposed to somebody who just sweats, like I told you, the way I sweat, which is coming off.
Oh, dehydration.
Right. Okay. But that is the mechanism for heat loss during is evaporation. You know, and this is another thing. I don't know if I shared the story about when I used to travel the country and go to facilities to do this kind of training. And did I tell you when I was up in Syracuse, there was the club had just recently lost a member that week. Did I tell you that story? So, and ever since I learned this, I make sure, you know, because I go to people's homes and a lot of times, you know, they finish their exercise and they're like, all right, I got to rush. I got to get out of here. And I know that they're about to hit the shower. And especially this time of year, please make sure that you let your clients know that they got to build in some time, you know, for further cool down. Because even though you'll take your clients through the process of cooling down, and this is even at the gym, okay? I actually had 2 stories. One when I was doing training this one particular weekend, and then I was a GM of a place where this actually happened. It could have been worse, but you know, I'll explain in a second. But the bottom line is, what I'm about to tell you would have happened regardless because there was pre-existing problems. But worst case, somebody can just get dizzy, they could pass out, they can hit their head, that would be the least, and then there's death. Okay, so the story in Syracuse, they had a member that, you know, was bouncing around the gym, big facility, playing tennis, weightlifting, all that, never did a proper cool down, hit the showers. Now you have hot, so the core, the body is trying to keep itself cool. So in that process, blood is being diverted to the skin surface, okay, to release the heat. And for that time, which is normal, the heart and the brain is taking a cutback, just like exercise, that happens. But now you have cutback because of exercise, and now cutback because the body's trying to cool itself. Now add hot water to your skin. Okay, now we're talking about more of a cutback, right? If a person can't risk that, you know, doesn't have that kind of blood to spare, right? Because there's some sort of pre-existing issue like a blockage or something, person will have sudden cardiac death. Okay, so that's what happened in Syracuse. You know, I don't know if this person was aware that there was some pre-existing issue. And then I had it with a member of mine. He didn't do a warm-up. He lifted heavy weights. Normally his routine would be to go to the sauna, the steam room, but that night he wasn't feeling well. We found out later that 3 weeks before he had he had been complaining of chest pain, so he was being evaluated. Not sure why they didn't have any, you know, I don't know if there was a diagnosis or whatever, but why that 3 weeks he didn't already have, you know, they weren't doing further testing or whatever they were doing. As far as I knew, he just went for an EKG, but he left the club and he died in the parking lot in his car. So, like I said, two different people, but 2 people that definitely had pre-existing problems with cardiovascular disease. But, you know, even if we just take the minor risk of adding hot water to a body that's trying to cool down from exercise, minimally, they're probably going to feel a little dizzy. Okay, so I always make sure that I'd rather cut the session 5 minutes and give that person time to sit, okay, than to risk the chance that they're going to go into the shower and, you know, pass out or get dizzy and hit their head, okay? So I can't stress that enough. Make sure you have to be the one that's, because most people don't think about this, okay? So you're going to have to be the one, you know, the voice of reason and say, listen, if you hear that they're rushing off, please take an extra 5 minutes and just cool down. Make sure that you cool down before you go in, okay? Yeah, I can't, you know, that when, you know, obviously when things like that happen, it makes me, you know, more reactive to it, but it's, you know, something that, you know, I feel it's very important to share. Okay, all right, in 23, in which plane does hip flexion and extension occur? This is 23. I'm sorry, say that again?
I put sagittal.
Correct, all right. Let me see, I'm just gonna put in here and they have the planes. Actually, I think it was on this, let me just see, it was, oh, here we go. All right, so this is your textbook, page 60, right? They have all of the different planes, right? So if we look at the sagittal plane, what does it do? How does it cut the body?
I don't know. I have a hard time with this one.
It cuts it side to side, but which movements for which plane confuse me, because if you're doing flexion, you're moving to the front to the back.
So a sagittal plane is cutting the body to a right half and a left half. Now think this is the best way to think about it, right? So the plane is this way, right?
Yeah.
Okay, if I'm moving along the plane, I'm moving this way. Okay,
Right.
where the
This is a different lecture.
frontal plane, okay, the frontal plane of the corona plane is cutting my body front half, back half. And if I move along the plane, I'm moving along. So that imaginary, I think of it as like a glass wall, right? So
right.
Or would
if
that
I
be,
have a glass wall that's going to cut my body right and left, I'm moving front to back, okay?
so would the frontal plane be abduction and adduction, or would that be in the transverse?
So frontal plane cuts the body front to back, and the plane, the glass wall is here, so I'm moving along, okay? So sidestepping, jumping jacks, okay? All right, does that make sense? That's the way that I've learned it. That, or, you know, because again, I struggled with this as you are as well, but I kind of just looked at these planes as imaginary glass walls and visualized myself moving along that wall.
So it's like the wall, the glass wall, you have your hands there and you just kind of like sliding along the glass wall.
That's exactly right. So
Right.
that's a great analogy. If you were lying down in the snow and doing angels, what plane are we moving in?
Well,
That
that
would be the
would
frontal.
be the frontal.
Right.
But
Exactly.
if we're, so we're abducting an arm, that's frontal, correct?
Correct.
So if
Okay.
we're, but when we do hip abductions and adductions, we're doing transverse because it's rotational, no?
No, because rotational would be that there's, you know, when you do abduction, adduction, unless if my toes are forward, you guys see my body?
Yeah.
Yes.
So if I'm doing abduction, abduction here, right? If I want to do abduction with rotation, I'm doing this, right? My whole leg is turning.
Oh, when you sit on, what I'm saying is like the machines that they have in the gyms, you're moving on like a rotational open and close. Is that
Oh,
transverse?
you're talking about this one here.
Yeah, yes.
So you're in a seated position. You're still doing the same motion at the hip joint, whether you're seated or standing. Okay, yeah, you are doing some rotation there. You do have rotation for sure. Which is, you know, actually the first time I'm thinking about that. You know, if we're doing, you know, if you're doing an abduction, you know, for outer thigh, inner thigh, right? You lay down, have someone on a mat. If you didn't have equipment, right, and they could do this. Okay, that's purely abduction, adduction. It's actually the first time that I'm actually analyzing the machine, because yes, and actually there is, I think in that case, this is the first time so this is what I'm telling you. You need to know this stuff to be able to evaluate exercise, right? So you guys know what I'm talking about, right? If I had no equipment and I wanted to work somebody's abductors, right? I'd lay them down. You see me?
Yeah.
Okay, so we're doing this, right?
That's through the frontal plane.
Right, so but what was mentioned about that machine is we're doing this, okay? Pushing, so it's more rotation than it is abduction. So that's interesting. So what I'm trying to say is that you may not be working the muscle as efficiently on a machine as you're doing on the exercise I just showed you on the floor.
Okay.
Okay, but
Can you give
yes, go ahead.
Can you give an example of some kind of movement in the transverse plane then? Because I'm trying to grasp this.
Okay, so transverse cuts, where does it cut the body?
It seems like top to bottom.
Right. The analogy I think I used was if you've ever seen a magic show and they put the person in the box and then they appear to cut that person and they move the box and they have so now we have a bottom half and a top half. I'm not going to answer it. Somebody help out. What exercise would do that?
Core rotations or Russian twists, right?
Well, so now you're adding the twist part of it, right? But if you want just purely transverse, what would it be? How about this? Right?
Okay.
So I'm cutting the body. I'm moving along that plane. Okay,
Yeah.
the glass is here.
Yeah.
I'm moving along that plane. Okay?
All right.
Bring the obliques into it. Yeah, it's all, anything. So the plane isn't just so it's here, right? So I'm still moving in that, along that plane. Okay?
All right.
That make sense?
Was that rotation? Is that transverse then?
Yeah, it's trans.
Okay.
Yeah, because now it would still be transverse plane.
Okay.
Okay, because you have that rotation coming at the, but we're still moving along that piece of glass.
So is it a better way to think of it is so that it doesn't cross over into another plane, whatever movement is occurring in that? I don't know. I know I'm probably not saying that right.
No, I understand what you're saying, but yeah, if you're doing, like what we were talking about before, if you talk about ball and socket joints, that's the hip and the shoulder joint.
Right.
Somebody could be doing an exercise that isn't just pure flexion, extension, abduction,
Right.
but now we're bringing in what's called circumduction, right? So you're doing a combination of at ball and socket joints. So it may also then be looked at as different planes as well, depending on what part of the movement. All right, but if we're just talking about, to be quite honest, guys, in something I learned, just like you guys learning now years ago, do I use it in my practice? No. All right, but the planes and the axes as described in your book, they get into it because in order to make sure that you are, you want to create a program that's going to allow every joint to move through its full range of motion. And, if you're working in all the planes, you're going to be covering all the major muscle groups. So that's where this all comes in, is that, if you consider the joint movement, the planes of movement, and you prescribe exercise based on that, then you have, a good way of knowing that you're covering all of the possible motions that the body can do.
Okay.
That's the purpose. But do I use this in my scope of practice? No, I don't. Usually the only time that I talk about planes of movement is if I'm doing a certification. Okay, so you have to know for the test, but then will you use it going forward? I mean, maybe you will, I don't know, but just in my experience, I have not used the planes of movement. But the joints, that's why I say it's very important to know, joint movement, okay, and what muscles cross those joints so that you can effectively create programs. But
So just to make sure I'm understanding, a squat would be frontal plane then, correct? Because you're moving up and down with the.
so yes, exactly.
No,
Okay.
Okay, so anything front to back, like give me an example that would move then, so also for the legs, but in the sagittal plane. Movement front to back.
Extensions.
Yeah, so any of that, but if I was just doing like just a body weight thing, right? Would you consider this? Or even this, right? If I'm doing lunges forward or back, right?
Yes.
Moving
Yes.
along that plane.
Yes.
Okay.
Okay, as opposed to the frontal where I'm doing, let's say, side steps like this or jumping jacks or something like that, snow angels. Okay?
Okay.
Thank you for going into that.
Yeah, no worries. No, listen, yeah, it's funny because you guys just bringing back memories, and I don't know if it helps, but I figured if I can tell you I was struggling with the same thing years ago, if that's a comfort, I'm not sure, but again, know it for the test. I think if you do, think about it, like I said, for you guys, just go into the gym and watching people do stuff, and then try to apply it to the stuff that we're, learning now. I think that it will kind of solidify it a little bit more. But like I said, once you learn it for the test, using it in your practice, maybe, I don't want to say no, because there's so many avenues you could go into. So maybe whatever you decide to do will be something you need to know. But one thing that you need to understand about terminology is that, and I think this only started, I'm not sure about all the medical terminology, but I think when I looked this up, it was like back in the 70s. That's really when they started to, talk about all these terms, the planes, anatomical position, flexion, extension, abduction, all the motions at the joint. This was in the medical field. Why do you think that's important? Okay, you guys are in Chicago, I'm here in New York. Okay, I'm gonna have a conversation either through text, email, phone call possibly, but you're working with a client, I'm working with a client, whatever, and we want to kind of like, collaborate a little bit and see if we can, you have the expertise in whatever this person's issue is that I don't, but I'm reaching out to you, and we start talking about all of these terms. Why is that important?
Communication, clarification.
Right? If I say to you, what's anatomical position? I said, all right, from anatomical position, right away in your mind, you know that I'm talking about this, right? There's no argument about that.
Right.
So the terminology it gives a baseline and an understanding, regardless of, whether you're in the same room or we're miles apart. All right. If I say anatomical position, right in your mind exactly what I'm referring to. If I say that during flexion, you're going to know exactly what I'm talking about. So it just sets a baseline and gives that person the ability to communicate on the same level. Okay, so that's why these terms are actually, and I was actually surprised, and I still doubt whether that's the case, because 70s wasn't that long ago. So it just cracks me up that they really, and these terms I'm sure existed, but they didn't really use them in the medical field till I believe it was sometime in the 70s. So pretty interesting. Okay, what are we up to? 24, right? Which muscle group extends the knee?
Quadriceps.
Got it. Okay, and where are the quads?
Front thigh.
But that,
Okay, and what about the other one, the glutes?
Right above.
Right, buttocks, right? Hamstrings,
back of the leg.
Back
Back
of
of
the thigh,
gastrocnemius,
the
That's the
calf.
calf.
right? The largest muscle in the calf is the gastroc, and then behind it is the soleus. Okay.
Totally.
Alrighty, 25. A client needs to improve the function of type 2X muscle fibers. Which activity should the personal trainer recommend? First of all, what is type 2X?
Fast
Fast
twitch.
contracting,
Yeah. Fast contraction.
fatigues quickly.
Correct. All that. Yes.
Produces
Now, do we?
good power.
With sprinting, we all of a sudden get into a sprint. Do we just go right to type 2X?
I believe so.
No, you go through
It's-
type
yeah.
1 first,
Type one.
right?
Right,
Yep,
because it's a
it's-
combination.
No.
Type,
Yeah.
wait,
Right to 2, right?
Right, yeah, type 1 to 2 to 2X, right? There's a recruitment process. We don't bypass the other types of muscles. It's, the body goes through that process until it realizes what fiber it really needs to rely on, okay? So I think I just gave, which activity should the personal trainer recommend?
Sprinting.
sprinting.
Right, sprinting, okay? Because for all the reasons why you said what type 2X is, right? It's quick firing, it's producing energy aerobically or anaerobically?
Anaerobic.
Correct, right? So these other things, dancing, cycling, walking, we do them for extended periods of time, right? So we can't be in those anaerobic fibers. We would be using more of, type 1, type 2, okay? Mostly type 1, all right? But sprinting for sure, type 2X. Okay, 26, which combination of exercises targets the pectoralis major? First of all, where's the pectoralis group?
Chest,
Back.
Upper
the front of the
Back.
chest, pecs.
Yes, right? Pectoralis major is here. Okay, PEX. Guys, I'm sure you've heard PEX.
Oh.
It's a machine at the gym called the PEC deck, right? If you're not certain about this, look at all those machines usually have a plate of what and the muscle colored in. So look at that. But certainly refer to your textbook in the chapter on muscles. All right. So what exercise targets that out of these four?
Let's see.
barbell bench press and dumbbell fly.
Okay, you got it. See, dumbbell, right? Barbell bench press and dumbbell flies, right? So what's the first one? Seated cable rows and dumbbell pullover. What muscle?
That would
Muscles.
be
The lats.
Yeah, the back muscles, right? Overhead extension and barbell curl.
shoulder. Wait, biceps and shoulders.
Yeah, exactly. Leg press machine and dumbbell lunges.
Quads.
Hamstring, quads, glutes.
Yeah, legs, right? Leg muscles, right? So the only one that makes sense is the barbell. And one thing that makes me nuts, guys, and let me ask you guys, you're leading an exercise class and you have everybody grab so I just told you the pec deck, right? Okay, is an exercise on a machine. But now, either you're leading it or let's even say, because I know you guys are gonna be smarter than this, you go and take a class where the instructor asks you to grab weights and do the pec deck. Are we working the pecs?
Free weight
With
light.
that movement,
Say again?
I'm thinking
with the
no.
back deck, yes.
No, we're not.
Right, what
Working
muscles
shoulders.
working? What muscles
Shoulders.
working to keep the arms up?
Right.
Shoulders.
Yeah, your
Shoulders.
deltoids. It's
Right.
not that you have to either have a machine,
Right.
okay, to be able to work. You don't even feel if there's any innervation. If you're ever wondering that, you could feel that the deltoids are totally, the chest is barely, but if you lay on the floor and do that, now you get the innervation of the pecs. But I can't tell you how many times I see that in exercise classes. Yeah, so yeah, that's another thing that you should have a sense of is what position, in terms of gravity, okay, if you're working with dumbbells, does your body need to be in order to work that muscle efficiently? Or you're going to be on a machine where there's a pulley system with cables, and that's going to make that exercise possible in that position because you're using a pulley and cable system, okay?
All right.
Right. 27, after working with a trainer for 6 months, an individual has reached their initial goal and is preparing for their first 5K. Okay, everybody knows what a 5K is, right? Race,
Right.
Yeah.
walk, run, okay. Which stage, okay, again, this is something we haven't talked about, we will Tuesday. Which stage of change does this describe?
Maintenance.
Action.
Action.
It's not
See,
like this was a trick. I answered action.
I answered preparation.
It's
Yeah, the
preparation.
maintenance.
That's right, it was D, maintenance. All right, but
Maintenance.
we'll go through that on Tuesday, okay? These are, again, would I use this? I mean, this is a good way to tell you, it's, when I was studying for my doctorate, you can't do a dissertation unless you adopt some sort of theory, sometimes multiple, you just can't write a dissertation without it. So this is how I look at that, is that, these theories of behavior is just going to tell you how serious that client is, okay? So you're really just going to have to read each of the, the stages and get familiar with what those stages are, the names of them and what they are, okay? And that's going to give you some idea in terms of where your client is in terms of, their readiness, okay? All right, 28.
Which movement is performed during a dumbbell lateral raise?
I don't know, I heard that too, but I'm not sure what. Is that a question for me? Okay. All right, 28. A client increases the frequency, intensity, and total volume of a workout. After 2 weeks, the client reports excessive muscle tenderness, difficulty sleeping, and a noticeable decrease in performance. What is the most likely cause of the client's complaint? Okay, again, we'll talk about this on Tuesday.
C,
Overtraining.
training.
E,
Yes, someone said C, overtraining. Okay, yeah, that's definitely a sign of overtraining. They probably, well, you tell me, what do you think? So it says a client increased the frequency, intensity, and volume. Would you suggest that to somebody? Would you increase all of those at the same time?
No.
no.
Right. Okay, so this was just, too much, too fast, and that's considered overtraining. Okay?
Mhm.
And mainly because there's a lot of things. I mean, after 2 weeks, the person has excessive muscle tenderness. I mean, what is the usually the range of time that people will be sore after a workout?
2 to 3 days.
Yeah, up to 48 hours usually, right? There's immediate. Some people get sore right after, hours after. The next day, 24, and then there's delayed muscle onset, which is 48 hours out. But now this person's coming to you saying it's 2 weeks later. Okay, so right there's an issue. Difficulty sleeping, okay, and then a noticeable decrease in performance for sure. Okay, I think I might have shared the story with you. One of my professors, when I was at Adelphi for exercise physiology, he trained. His clientele were triathletes, and he met with them initially, but then a lot of it was through correspondence, and the guy just went off. He took what Bob wrote and just said, well, if this is good, then more is better, right? And, we know that people are like that. And when Bob saw him months later, he's like, what the hell happened? And he could see the signs of overtraining. And he says, if you don't stop, there's going to be some adverse effects. And if I did share this, I told you that this guy hurt himself so that he was unable to work out for 1 year. He couldn't train for a year because he messed up his body so much. Okay, so this is a real thing. All right, 29. Which anatomical plane divides the body into a right and a left half?
D,
D.
sagittal.
I love it. That you said that with such certainty.
We are very confident right now with that one.
I love it. I love it. Oh, if we ended right now, that would be a great way to end this session. That was right on. I love that. All right, so everybody knows, right? We had this discussion just not too long ago, right? So is everybody comfortable with that question now?
Yes.
Sure.
Yes.
I'm so confident that you guys are
More
going to
than
have
before.
you guys are going to have these plain questions, no problem. Good. All right. 30. A personal trainer needs a physician's consent. The personal trainer must meet the requirements of HIPAA. We already talked about HIPAA, right? Which of the following must the personal trainer do before contacting the doctor about the client?
B.
B. Yeah.
Have a client sign a patient information
B.
release.
Yeah, B.
Okay. Yeah, it's definitely B. Yep, it's a resounding B. So yeah, have the client sign a patient information release form. Okay. Right, because they want. Why should they do that? Like, wait a second, if you think about this, there's reasons for me to consent, to get in touch with the doctor. Why do you need to have the patient sign a release form?
Just can't have people all willy-nilly calling doctors about your personal stuff.
Exactly right. You have the right. If the person refuses, you have the right, and if you're following the guidelines, you should refuse to work with this person. You could go ahead, and I think I shared with you when I was the GM of that corporate club. I had people, they came in and, they either they knew they were hypertensive, or they had just found out because I had taken 2 consecutive readings, and I was like, I can't accept your membership. I wouldn't take their money. I said, here's the physician's form. Please take it to your doctor and have it filled out. And people literally got mad at me. And, at the time I had the yellow pages, I would just open it up and say, listen, I'll give you a list of probably a dozen clubs in this area that will take your money right now. I'm going to tell you, your problem will still exist. You should go see a doctor before you start an exercise program. But people will literally get mad at you for asking them to do that. So, but you don't want this on your, I don't think anybody wants this, a situation on, your time, right? So send them off to somebody that, if that's what they want to do, send them off to somebody that, will have that happen, on their watch, not yours. All right, 31. What is the primary muscle group used to perform the overhead shoulder press exercise? All right, we know what the overhead shoulder press is, right?
B.
Yeah.
Deltoids.
Yes. Okay, so that was
Deltoids, yeah.
Yep, deltoids, good. All right, nice. If we work in the traps, what would we do?
Shrug.
Yeah, exactly. All right. Triceps, we know kickbacks, right? And then biceps is the curls. All right, 32. According to the American College of Sports Medicine, ACSM, which individual meets the requirement to count family history as a positive risk factor?
E.
D.
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 Okay, so I heard B and D, but what are we, 32? Yeah, D is the correct answer. Okay, a male whose father had a heart attack at the age of 48. Remember, I was telling you that there are different guidelines. So if you have a client, or just anybody who has lost a sibling or a parent, depending whether mother or father, okay, for women, if you lose a mom or a sister, I think it's up to, anything less than 60, where for males, it's either 50, 55 or 50. But yes, that's definitely a risk factor. I told you my dad died, but he was 81. Okay. But yeah, if you, somebody had a heart attack or sudden cardiac death, okay, that definitely would be a red flag, according to the American College of Sports Medicine. Again, they do extensive research on, hundreds of thousands of people, and that's how they gather their data to determine what's a risk. Okay, that should definitely be checked into. All right, 33. What does the sliding filament theory describe?
I put A.
Okay. And you sound a little doubtful. Is that?
I do. I don't
Yeah, I
really
didn't
understand
Called
that.
C.
I didn't put
I
anything.
also put A.
I read through.
Okay, so
I
A
was
is
so confused.
how muscle converts ATP to mechanical work. B, how fast twitch fibers become slow twitch fibers, right? Not really, right? How the body switches from anaerobic system to aerobic. No. How the body arrives at post-exercise consumption, right? So we know the sliding filament theory, right? It's the actin and the myosin. We have a picture. Let me see if I can put that in. Yeah, and I know it's in your slides. Okay, let's see if they. Trying to find the picture. Oh, and this was the EPOC thing, guys. Right here. I don't know if you guys could see it, but there's figure 4.3 talks about that oxygen deficit and the EPOC on the other end to pay it back. Okay, here we go. Right. So we have, the thick bands and the thin bands, actin and myosin, and then when muscle contraction happens, it's doing this. Okay. So the best one, and in order for that to happen, ATP, right, which is what we need to create energy, that has to be converted to allow that to happen. That's the mechanical work. Okay. So if you look at the others, they don't make, we're not talking about what type of muscle fibers. This happens with all muscle fibers. We already said that when we're doing work, we recruit them according to what we're doing, right? But in the order from type 1 up to 2X, okay? So we're not specifically pointing out fast twitch, slow twitch, so that's why that one doesn't make sense. The third one, we're not talking about switching to anaerobic and aerobic because mechanical work has to happen whether it's under, the presence of oxygen or not. Right? We still need ATP to make that work. And then the last one, we're not talking about EPOC here, okay, how the body arrives at EPOC, right? That's just paying back the oxygen at the other end. It's not, at that point, we're talking about, cardiorespiratory system. We're not talking about, muscle fibers, okay? Does that help?
Sure.
Okay.
Yeah.
Right, great. All right, 34. In which situation should the personal trainer refer the client to a professional therapist?
Eating disorder.
C. Eating disorder.
Yeah, for sure. So difficulty falling asleep. I mean, listen, again, you have the right to ask for, to refer a client, based on. So, if someone is telling you that, and you see the signs that they're not able to sleep, yes, maybe that you might want to suggest that they go see a doctor, right? Non-compliance with the program, unfortunately, we're going to be dealing with a lot of people like that, but that's not something that you really need to refer someone to. Definitely eating disorder. And, financial problems, again, that's not, as long as they're paying you, it's, you're not there to be their financial, planner. Okay. So yeah, the one that makes the most sense is eating disorder. Okay. A personal trainer needs to design a fitness program for a sedentary 70-year-old client who has osteoporosis and a rotator cuff injury. What's osteoporosis?
Fragile bones.
Yeah, right. So yeah, bone loss. Okay, osteopenia, osteoporosis. Okay, onset of bone loss and osteoporosis is bone loss. Which series of fitness assessments should the personal trainer perform?
Put A.
Put A.
A,
Yep, that's correct. Arm curl test, chair stance test, 6-minute walk. Okay. All right. 36. Which of the following muscles are responsible for hip extension?
B.
Glutes.
Glutes.
yeah, glutes.
Yes. Right. So when I'm standing in anatomical position, I'm actually in hip extension already, but if I want to work the glutes, I bring the leg back, right? So that would be actually, it's actually at the joint, it's hyperextension, but yes, you have to do to work the glutes, you have to do hip extension, or to do hip extension, you need the glutes. Okay. 37, which is a primary source of ATP for exercise that lasts about 2 minutes?
I put C.
Glucose.
Yes. Okay. Definitely not fat, because it takes longer to metabolize. Protein is essentially used for growth of repair of tissue.
How long does creatine last again?
That one, actually, let's look that up. And some of them are available for like 30 seconds. It's like 30 seconds up to 2 minutes. But let me see if they actually have a number. I'm looking it up.
Glucose is the answer.
Yeah.
Okay.
Creatine, anaerobic. Yes, so they're both anaerobic. I want to say 30 seconds or so. Okay, because I know the range is anaerobically, it's activity. You're producing ATP without the presence of oxygen anaerobically, and it ranges anywhere from 30 seconds to up to 2 minutes. So I'm going to guess it's on the lower end, the 30-second side. Okay.
Thank you.
You're welcome. Okay, which of the following terms describes movement of the distal segment out to the side and away from the body in anatomical position?
Abduction.
What's that?
Abduction.
Abduction.
What's distal? What does the word distal mean?
A,
Furthest away.
Oh, right, exactly.
Yeah.
Okay, so distal, proximal is closer, distal is further away. Okay, so you guys said, what was the answer that you gave me?
B.
Abduction. Abduction.
Okay, abduction, yes.
Okay.
Okay, we good on that, guys?
Yeah.
yeah,
All right. Okay, 39, a new client needs to isolate biceps during a resistive training session. Which type of exercise should the client perform to achieve this goal?
A.
A.
A is seated curls on a preacher curl machine, right? Everybody knows what that is. You sit down, there's usually a padded, like angled
Right.
here, and you're forced into just flexion and extension. Okay. All
was
right.
that? A was correct, right?
A is the correct one, right?
Okay, thank you.
Well, welcome. Yeah, because the others, you would be tempted to, there could be some movement at the shoulder joint that might, bring in some I mean, you're never truly isolating muscles. You should understand that, but you know, because muscles work as stabilizers, and you know, we already talked about agonists, antagonists. So, but out of these four, the best choice is the preacher girl. 40. Which statement most accurately describes the characteristics of respect for fitness professionals?
A.
Okay, so
Holding
A
a
is
positive
correct.
regard.
Holding a positive regard for the client. You don't want to judge their actions. Pointing out differences. Definitely don't want to do that. Whether you think them, just keep them to yourself. Setting precise goals and communicating with the client. All right. 41. At which point does the cardiovascular system reach its limits to transport oxygen to muscles?
VO2 max? A?
Correct, right? So V, what does the VO stand for? VO2.
Volume of oxygen.
Right, volume of oxygen max, right? So that makes sense. Okay, 42. An individual is injured during a fitness or athletic activity. No one is legally at fault. Which term describes the situation?
B.
D. D.
Yeah, it's D. Okay, so product liability, fitness or an activity. It is, yeah. No one is at fault. The one that we did earlier was inherent risk, right?
Yep.
Yeah. And I think Tuesday we'll talk about liability, you know, but I'll just throw that out there, you know, ahead of it. Always make sure whether you're working, certainly if you're working independently, but even if you work for somebody, yes, you'll be covered under their liability insurance, but it's always best to have your own, because if you're, you know, working with a client one-on-one, you're teaching a class, whatever it might be, you're the one that gave that exercise to that individual. The club didn't, right? You were working for the club and you asked that person to do that activity and they got hurt. Okay, so a good attorney is not only going to sue the club, but they're going to sue the person who directed that person to do that movement. Okay, so it's always prudent to have your own liability insurance. Okay, it's not a lot of money, guys. I mean, we're talking, you know, $100 to $200. You know, if you have, as WITS is a, you know, an accredited certification, your rates will be better. Okay, and I'm pretty sure WITS probably has a an alliance with a liability company for that, an insurance company. Okay, 43. A female client is 58 years old. She has never smoked and she denies having a family history of heart disease or heart attack. She has a normal fasting glucose and a total cholesterol of 180. The personal trainer calculates her BMI to be normal and takes a resting blood pressure, which is 115/76. The client is currently active. She walks 3 miles, 3 days a week. She wants to work at vigorous intensities during her training session. The personal trainer performs a risk stratification to determine risk and the need for a physician's consent. How many risk factors are present in this situation?
I just said one.
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 0.
So what is it? What is the risk factor?
For age.
For age.
Correct, right?
Which kind of
58, everything else checks out.
Yes.
All right.
What age becomes a risk factor then?
55 for women.
45 for men.
I believe so. Yeah, 45 for men, 55 for women. Okay. The minimal intensity threshold is achieved. Minimal intensity threshold is achieved. What is the most important variable to determine cardio? It's kind of like what we did earlier, right? Cardiorespiratory fitness gains.
Oh, A.
Correct. Okay. Total work accomplished in a session. Type of exercise equipment used, frequency of exercise sessions, duration of exercise. Yeah, so we would want to look at the total work. Okay.
Sorry,
Yeah, no
I
worries.
live by a hospital close.
Oh, okay. Well, that must be Although I guess once you live in a location like that, you probably can sleep like you probably if you go out to the woods or something, you probably have a hard time sleeping. I think.
No, I do not. I hate it. I love my house, but I love that the hospital is there. But yeah, I hate it. I'm a very light sleeper.
Oh, so
So
you
I
haven't
need the
got.
forest.
Okay, that's great because I moved almost a year ago. It's near the there's a train that goes by many times throughout the day, but it's funny because eventually you kind of like I hear it still, but there are times when you don't. You know, it's just weird how you get used to stuff. I always think about that movie, My Cousin Vinny. You guys see that movie?
Yes, love
Yeah.
it. Yeah.
Yeah.
The train.
Oh my God. So funny. So many parts about that movie is hysterical. All right,
Oh,
45. A client who participates in a resistance training program has heart disease. What should the personal trainer recommend?
I put
I put
C.
C.
yeah, C is the best answer, I think.
Engage, right? For A is engage in a program that consists of heavy resistance exercises. You know, the whole thing here is with somebody who's hypertensive or has, heart disease, for whatever the reasons, blockage, it's that whole Valsalva maneuver thing, that holding the breath. So that's why engage in a program that consists of moderate resistance exercises. A lot of doctors will kind of, because of the Valsalva maneuver, they'll, ask the person not to do intense heavy lifting because they're afraid of that, and that would raise blood pressure and heart rate. Okay. All right. The gastrocnemius and soleus are responsible for which movement at the ankle? We already talked about this.
Plantar flexion.
Plantar.
Correct. Okay. So give me an exercise.
What was the
Calf
answer?
raise.
I'm sorry.
Calf raises.
It's D, plantar. So right. This is what's this?
Dorsiflexion.
That's dorsey.
Right? So that's plantar. So this is the dorsal surface of the foot, the plantar surface, and we're going that way. All right. So
Right.
calf raises, right? Would
Right.
be plantar flexion working the
I always
gastrocnemius.
think of it like pointing up as like a dorsal fin, and pointing down, you're planting your foot to the ground.
Good. Okay. Good. All right. All right. 47. A client is running a 10K. Temperatures are expected to reach 85 degrees Fahrenheit with a 80% humidity level. The client should focus on replacing which of the following?
Water.
Water.
Yep, for sure. Okay. All right, 48. A new client is classified as sedentary. Which fitness routine is most appropriate for this client?
D. Walking, starting with walking.
D, you said?
Yes. I said
Yes,
D.
that's correct.
Yeah.
A walking routine that focuses more on duration than program intensity, right? So get them out there doing their thing, and then you can start to focus on intensity level as the person's fitness level. Okay. 49. What is a neuron, its branches, and the muscle fibers it innervates?
B.
I put D, motor unit.
Motor unit.
Yeah, and that's
Right.
actually in the, is that this one here? In the which one called that we were looking at before, they show the muscle. You have it in the slides. It starts off with the muscle and then they pull out, segments of it. Go back and look at that, and that'll give you a good idea of, how to answer this question. Okay.
102 in the book.
You said it was D, correct? Motor unit?
Yeah, a motor unit. Yes. Okay. Let me just put it in here. Let's see if it'll give me motor unit. I don't like the way this thing is responding now, and I forgot which chapter it was, but it was
Page 102.
what is it?
Page 102.
102. Okay, so I'm on page 102. Let's see if I go to here. There we go. That's the picture I was talking about. All right, so it takes you from the tendon, the muscle belly, and then it breaks it down all the way down. Okay, and I think it goes on to show the myofibril, but yeah, so this would be where you want to focus on if you want to learn more about that for question 49. Okay, pronation and supination occurs at which of the following joints?
Radial ulnar.
ulnar.
Yeah, so I think I gave you guys, and someone might have even had another one. How did I tell you to remember that?
Soup and throwing out the soup.
Right, soup, right. So supination, you're holding the bowl of soup, and then pronation, you spill the soup. But I think somebody had another.
Prone, what I tell my students, prone to spill the soup.
Okay, all
You're
right.
prone
Yeah, so
to spill the soup.
yeah, so I mean, all you have to do is remember one of them, right? And then you'll always know what the other one is the opposite. Okay. Med students, by the way, guys, use all of these things. So they're out there if you want to, if you look them up, if you want good ways to remember, whatever, you know, medical students rely on them all the time. All right, 51, wait, no, I skipped, right? Oh, no,
No.
a sedentary 55-year-old female client has a body fat percentage of 42. Which activity is typically contraindicated for this client?
B, jumping rope.
Yeah, why would that be? If that happens to be correct, why would you say that?
It's too intensive.
Stress on the
Yeah,
body.
right. High impact activity. I don't know if you know the difference between high intensity and low intensity. Or maybe you want to take a crack at that. Like what constitute excuse me, high impact, low impact, not intensity. High impact, low impact. What's the difference between the two?
The impact on your joints.
Yeah, but what's actually physically happening with the feet in relationship to
You're
space?
hitting the ground.
So yeah, but there is a moment. High impact activity is when both feet are off the ground. That's running, right? There's a moment where both feet are off the ground, and then therefore, boom, the impact to the ground is greater. Where low impact activity, like walking, even though it's the same motion as running, there's always a foot in contact with the ground. So that's a difference between high and low. All right. So typically we want to start, you know, someone off with the low impact activity and then work them up to high impact. Okay.
Mhm.
Okay. 52, and we can make this the last one, but cardiac output is calculated by multiplying which two factors?
Heart rate and stroke volume.
Correct. Okay, that one, again, I know we went through that. It's in the PowerPoint. It's definitely, it will be in the book, but that one you're just going to have to know cardiac output, right? It's how hard the heart's beating, and or how many times the heart is beating, and then the amount of blood, that stroke volume that's going out with each beat. Okay. We'll do one more, right? And then we'll sign off. 53, according to the American College of Sports Medicine, what is recommended minimum amount of daily physical activity for children?
60 minutes.
60.
D,
60 minutes.
60 minutes, okay? So they have guidelines for everybody, you know, children, adults, seniors, and so on. But yes, the correct answer is D. All right, not too bad. We almost got through half of them. There's 110 total. So, you know, like I said, we have lecture Tuesday, that'll be our 5th, but then the following 2 weeks, there will be review sessions. So if we're the same group, then we can pick up where we left off and then maybe get some other, because I know there are Quizlet. I don't know if you guys went on the Canvas site, they have Quizlet, you know, which are like flashcards. So if you haven't looked at that, I would definitely look into that. But yeah, either we'll be able to pick up where we left off, or you know, maybe what I'll do is, even if we do have new people come in, we could pick up where we left off, and then this way, the following week, if we're reviewing the ones that we just went through, you know, you could always, you know, not come if you feel that you have a good handle on the first 53. Okay, so maybe that's a good idea. Start at 54, make a note, and then. You know, this way we continue from here, and then the second week the people can join who didn't do the first 53. That sound like a game plan, guys?
Yeah, sounds good.
Good.
Yeah.
Thank you so much. Thank you.
So, I just
I have
found
a
hours that you guys seem like there's no, you know, the same intensity that you guys were feeling the first 4 weeks. I hope that that's the case.
It's better. It's
Okay.
better.
It's better.
Still intense, but it's a better.
It's
sense.
pretty intense.
Yeah, you know, and like I said, some of this stuff you just got to know it for the test. You know, you may use it, you may not use it, you know, but try to try to learn it instead of memorizing it. That's probably the best advice I can give you.
Right.
All right. So just try to find out. Like you guys know the planes a little, a little bit better than you knew them, 2 hours ago. So just apply it.
Right.
Do we
Okay?
know when the next review session will be, or we'll
Yeah,
find
right
out?
now it's slated for the 2 weeks after because that'll be before your
Well, our test is the 17th and 18th. So it would have been that Tuesday right before.
yeah, so yeah, we have the 9th, right? That would be the 16th. Yes.
Okay,
Is
thank you.
anybody testing after the 23rd?
No, I'm
No,
not.
not the written,
No, I don't think
the
so.
practical. Yes.
Okay. All right, because I know originally Jay and I discussed the 16th and the 23rd. I was under the understanding, but maybe he was referring to the practical. So, all right, so we'll definitely do the 16th though. So, as the second half. Okay.
All right.
All right, guys.
I've had a problem
Say again?
getting onto sorry, I've had a problem getting onto Canvas. It won't accept the school that I go from, like the 2-page COD one.
Okay, because I know you were also given, you had a username and a password that you should have received,
Okay.
when you registered.
Did you try typing
Yeah,
in
I'll
WITS
look
or?
further. Typing in WITS, I'll try. Yeah, I'll try that.
Yeah, yeah.
Just bring your computer Sunday, and we can see if we can help you get on it.
Okay, thank you.
All right, but yeah, I think I'm not aware that you had to go by your school. I thought that he gave you access by a specific, unless that's the WIT site. But I would definitely, if you could bring your computer Sunday, because if you try to reach out, I'm not sure if they'll respond to you before Monday. So you might want to just do it that way.
Okay, thank you.
Ready? All right, guys, listen, be well. Great job today. I really appreciate you taking some time out. And I'll see you guys on Tuesday, okay, at 6:30.
Thank you. Thank you.
Have a great day.
Welcome. You too. Bye-bye.
Yeah.